us today. And on behalf of the 5-star accredited Fort Bend Chamber of Commerce, I want to welcome you to this webinar. My name is Mike Dotson. I'm the chairman of the healthcare division for the Chamber, and we hope you and your family are safe and healthy. First of all, I'd like to go ahead and acknowledge our sponsors for today's event: CHI St. Luke's Health, Sugarland Hospital, CU People, Inc., Fort Bend Medical Society, Memorial Hermann Sugarland, Houston Methodist Sugarland, and Safe Harbor. Go ahead and introduce our speakers before we get started. First off, Dr. Connie Almeida. Connie is a licensed psychologist in the state of Texas. She's a licensed specialist in school psychology. In October of 2010, Dr. Almeida joined Fort Bend County as the founding director of the Behavioral Health Services Department. She received her PhD in psychology from the University of Maryland in 1985, followed by a postdoctoral specialization in developmental disabilities at the University of Massachusetts. She was one of the initial contributors to the development of the Child and Adolescent Needs Assessment in Texas. She worked for Central Gulf State operated MHMR and later on for Texana MHMR Center in several capacities, including the clinical director for mental health services. She currently serves on the advisory council for Fort Bend CASA and was appointed in 2019 by the governor to serve on the advisory council for the Department of Family and Protective Services. So welcome, Connie. Next up is Eliud Faz. He is the COO of Houston Methodist Sugarland. He has served previously as an administrative fellow with Methodist and is an 8-year member of the management team of Houston Methodist Willowbrook Hospital, where he eventually was named Director of Finance. He then served as CFO of United Surgical Partners International, where his responsibilities included all financial operations of 3 acute care surgical specialty hospitals, including Memorial Hermann Surgical Hospital, First Colony in Sugarland. He has a Bachelor of Science degree in economics from the University of Arizona and a Master of Science degree in healthcare administration from Trinity University in San Antonio. So welcome. Next up is Mathew Kelly. Matt is the VP of Operations and COO of Memorial Hermann Sugarland. In his role, he's responsible for the direction and management of ancillary operations. Before assuming his current role, he served as Director of Operations at Memorial Hermann Greater Heights, a 260-bed facility located in central Houston. Matt has a bachelor's degree in economics from UT at Austin and a master's degree in healthcare administration from Trinity University in San Antonio. He is active in numerous civic and professional organizations, including a board member from the Fort Bend Chamber of Commerce. We also have Sarah Reinitz from Memorial Hermann's psychological response team with us today, and she'll be helping out with some of the mental health questions pointed at Memorial Hermann. So please join me in welcoming this panel. And with that being said, we'll go ahead and get started. So Connie, my first question is for you. What is the outlook of mental health in our community right now, and what projections do you foresee in the coming months?
Okay, here we go. Well, first of all, thank you for inviting me to be part of this panel. You know, for years, we've worked to increase the stigma of mental illness among our community and to really, increase this awareness that mental illness impacts so many of us. We all know the statistics: 1 in 5 children, 1 in 5 adults will experience a mental health disorder. We've tried to increase access to mental health disorders. We've made some progress, great progress, in terms of integrating mental health into physical health. For example, the work that's being done is a perfect example of that. Memorial Hermann, a lot of the other hospitals. But what we're seeing right now is that the stress and the anxiety and the worry that is impacting so many of us is really unforeseen and of just great magnitude. And I think what we really need to be aware of is not only what we're experiencing right now, but in the next several months and possibly years. How has this impacted our children? How is this? We know that stress impacts physically and mentally, and often it takes a while for those to show up. So I'm really glad that we're having these discussions. These are discussions that we need to continue to have. So I always look at things on a continuum, looking at, what are the urgent needs right now, but also how do we look at prevention and really being much more proactive in helping build that resiliency in our community, which we all know about, those protective factors that will really mitigate some of that adversity that we're all feeling. I don't know if I answered your question, Mike, but I think
that's really good. Thank you.
We have to be very intentional about and strategic.
Completely understand.
And really,
Sarah,
yeah.
What advice do you have for families, specifically families with kiddos?
Yeah, that's a great question. I have 3 kiddos of my own at home, and I actually am coming to you guys live from my house. So I think just recognizing that we all are really in kind of unprecedented times. It's really kind of polarizing, right? We're all either very much together with the people that we spend our life with our family, but we also can be very isolated. So I think for families and for individuals who are trying to navigate this with children, some of the best advice that I've heard out there is think of it like you're on an airplane and that you have to kind of put your oxygen mask on first. So what we tell our kind of parents and our families is be sure that you're checking in with yourself, make sure you're taking care of yourself so that you can watch for some of the psychiatric or psychological implications in our kids. So some of the things we want to kind of look out for both parents and children are kind of that anxiety, and that's a lot of that anxiety is going to be surrounding kind of health and germs and wondering, could I get sick? How can I mitigate some of my risk and exposure? And I think with kids, we just need to watch out that children are very perceptive. They take on a lot of the emotions that their parents are feeling. So understanding kind of that impact on an individual, and then watching for warning signs in children. So what some of those might be are clinginess that kids need their parents. They might kind of seemingly revert to a more childlike state. Also tantrums, acting out, throwing some fits that might be completely unlike the child, but knowing that that might just be a manifestation of anxiety. Moodiness, physical complaints. So if kids start saying they're having headaches or stomach aches, just kind of trusting oneself that they know their child and that they can look at these signs and try to empathize and really speak with their children that things are going to be okay, and modeling kind of behavior that they too can be worried and scared, but that they're all together. But then also I think reaching out to a professional if need be. So I always try to tell parents, talk to your pediatricians. They are very well versed in the resources of the community and can really help navigate that process. And then direct families to people like psychologists, clinical therapists, or psychiatrists if needed.
Really good, thank you. So Matthew, along the lines of sort of this theme, obviously the folks that work for you aren't immune to any of the pressures that everyone is going through. How are you working with your frontline workers in regards to burnout or things that may be affecting them, beyond just sort of the normal day-to-day?
Yeah, Mike, that's a really great question. It's something that we wrestle with every day. I would answer it. I think one of the silver linings with the COVID crisis, it's allowed us to rethink how we do things. So traditionally, healthcare was not a work from home or industry. We've been able to kind of reevaluate that and allow some of our employees to work from home where it makes sense. We've also implemented wellness programs. So we have an entire employee wellness team who partners with our employees, and we have services that they can reach out and get. We've also set up something pretty interesting at this campus. It was actually funded by our employees. It's called just a relaxation room. And it's a place, this is a high stress industry, obviously, and it's a place where our employees, after a stressful situation, can go and just absolutely decompress and maybe take 5 or 10 minutes to just get away from the stress of the day. And that's been very helpful, and it's been pretty unique for us.
Really good. One of the things you kind of hinted around there was a lot of folks working from home now, and that not being sort of inherent in healthcare. Eliud, do you want to talk a little bit about telehealth in your sort of day-to-day, whether it is focusing on your mental health practice or anything in that area, but also maybe just kind of blow it up a little bit to talk about your medical practice and what that has looked like, certainly during this pandemic.
Absolutely. Thanks for having me. I really appreciate the opportunity. Yeah, absolutely. So telehealth has actually helped us not just expand services on the outpatient side, but even on the inpatient side. We incorporated into telehealth in new ways that we hadn't really done before in order to better treat some of our COVID patients and get necessary consults done in basically a remote way. So we were able to marshal a whole lot of specialty resources on the medical staff via virtual consult rooms set up in-house. And so it really changed, like what Mathew was saying, it changed how we delivered care, not just outpatient where you saw telehealth really taking off and you heard a lot about it on the news and in the community, but also on the inpatient side, like I said before, which was great because it allowed us to deliver efficient care, effective care, also without having certain staff members or medical staff members having to step into the room, therefore not burning additional PPE or anything else that we were trying to conserve at the time. On the outpatient side, Methodist went through a huge transformation. The Houston Methodist organization went through a huge transformation during the COVID period, and we saw virtual visitations to our physician organization doctors go from being less than 1/10 of their daily volume to about 3/4 of it in a matter of a couple of weeks, which was something that was outstanding to see. The adoption happen so quickly during this time. It was kind of interesting how we moved the needle almost leap years forward because of the situation that was at hand. And so it was one of those things where necessity was kind of the mother of invention. In this case, it was kind of adoption, really. And we're seeing the numbers move back toward in-person visits, which is fine with us. We're basically here, and I think Mathew would echo this with Memorial Hermann. We're ready to serve the community however the community wants to be served, and really we're leaving it up to them to be kind of the decision maker in that process. We're offering all the options to be able to serve them appropriately. And it's just been interesting to kind of watch that go down, but it's not gone down back to pre-COVID levels. The adoption is still there. It's just not as high as it was at the peak of our activities related to COVID, in, let's call it, mid-April. So.
Thanks. Sarah, so obviously you have your existing patient base prior to COVID, but then you're taking on new folks. So how does integration work and what does that look like?
Yeah, it's a great question. So at Memorial Hermann, we have my department, Behavioral Health Services, that serves our entire organization. So all of our acute care hospitals, and then also some of our ambulatory sites as well. So what we really at Memorial Hermann are not doing anything different from a healthcare delivery standpoint, but what we are doing is making sure that the needs of the patients who come to us, and like Connie was mentioning before, all the patients that will come to us, we are preparing for them. So we have our inpatient psychiatric consultation service, which is clinicians who travel throughout the Memorial Hermann system and see patients in the emergency rooms, on the medical floors, and their job is to provide a recommendation to the treating physician regarding that patient's outpatient plan, whether it be transfer to an inpatient psychiatric hospital or following up in the community. Another great service that we have at Memorial Hermann are our mental health crisis clinics. So those clinics they function basically as a psychiatric urgent care. So they are a walk-in freestanding site that has therapists as well as MAs, social workers, and psychiatry or advanced practice providers on site to see patients and really, regardless of their ability to pay, which is a huge thing for us. And we're very proud of our DSRIP funding for that service. And we see those patients and provide them care to navigate them to the appropriate level of care so that they don't have to come to the acute care hospitals if they only need that mental health piece of their care. So we see them there, and we kind of use that as an access point, because what we know about mental health in our community and all the communities across our country really is that access is our biggest stumbling block. So we're very fortunate and very proud of offering that service. And then we also have two other programs. One that's a case management program that takes place in the community and in the home, and that is for our patients with severe mental illness. So we help them navigate the healthcare landscape so that they can remain well. And then our newest and youngest program is our integrated care program, where we are embedding behavioral health clinicians into our ambulatory care sites. And these are specialty care OB-GYN offices, pediatricians, as well as primary care offices, so that when patients do present to their primary care, which is their access point that they often present at, the physicians and treatment teams there have the resources to say, hey, I have someone right down the hall who can talk to you and who can help you through this. So we are really just leaning on each other. We're not doing anything different, but we are refining kind of our operations and also doing telehealth. So that's something that we also learned quickly and got on board very fast, and something to be proud of when kind of looking at the Memorial Hermann response to the pandemic.
Thank you. Connie, I'm going to kind of pivot off the script a little bit. We obviously are all aware of everything that we're dealing with beyond the pandemic, with the death of George Floyd, and as community, obviously that person is a member of our community directly. What's going on in your head when you're thinking about being somebody who employs folks, or being an employee, or just being a member of our community, and what should folks be aware with as we kind of move through the next weeks, months, year? And I'll just kind of let you take it from there.
Well, so, as you were asking that question, I felt both my heart racing and my stomach churning. It's kind of interesting how, the response that the impact that has. And so I think maybe that's where I would start. It's for us not to forget the impact that it has on us, on our children, and on our communities, and not to be indifferent. I think one of the things that we've seen is too many of these cases that are forgotten. So I, just want to make that point. We work a lot with law enforcement. We work a lot with community. We work a lot with really vulnerable populations. Of course, with criminal justice. So we're always looking at these issues, the issues about equity in terms of healthcare. We've seen the data even around, the impact of COVID and how the African American population has been more at risk. There's been more deaths among that population, more cases. We talk a lot about social determinants of health, and that's the fancy word for some of the stuff that we used to call wraparound supports or social drivers of care or poverty. But I think what we have all learned is how important those things are, how important, the food insecurity, people having access to healthy food. And it's been really remarkable to see, large hospital systems like Memorial Hermann and Methodist, and actually AccessHealth also, working with the Houston Food Bank and asking those questions. I mean, that's something that we didn't do several years ago. And now we're talking about housing. It's really, really important that if we're going to keep people safe, if we're going to keep people healthy, we really need to integrate those social supports, those economical supports, so that people can take care of those basic needs. I don't know if I addressed your question, Mike, but I think it was a really difficult question. I probably, just to go back to where I started, let's not be indifferent to what's going on around us.
That was really good. And I think we've got a lot of topics in this webinar, so I'll just go ahead and apologize for how crude some of these transitions may be, because we've got a lot of different folks and a lot of different departments here. But Mathew, obviously things are a lot different operationally for you. And you have to kind of hit the ground running as fast as you can. And we're changing daily, just based on how things are unfolding. Right now, as far as like infrastructure, what have you guys had to deal with differently? And I know, like, beyond just sort of your investment there, PPE is a big topic that has happened in webinars, and you can just kind of take it from there. I'd appreciate it. So I think we're having a little bit of technical difficulty there. So you're
Sure.
Matt,
Yeah, that's obviously we've had to change several of our processes, and PPE, as we've ramped back up, has been, I think it's been covered. I've had the fortune to be a part and listen to part of the previous three medical series, and you did cover that topic. One of the things I'll say is, as we've ramped up, we've got a great line of sight with our system to make sure that our employees and our visitors are protected. So every day, each of the campuses send out to our system office how many procedures that we have in all of our procedure areas. And we can take a look at that run rate 6 to 7 days out. And those cases don't take place or don't go on the actual schedule unless we know that we have an adequate supply of PPE for all of our staff. Happy to say that it has gotten a little bit better as the days have gone on. It was when we peeled back the clock back to March and April, there was some difficult weeks, but as we've gone into May and now June, we've seen that supply raised to adequate levels.
thank you. Eliud, I know that we're sort of kind of recapping some of the topics from the previous 3 webinars. We talked heavily in the first about COVID-19. We talked heavily about telehealth and safety, amongst other things. Would you mind just kind of elaborating on and maybe blowing that up a little bit? Just kind of what you've seen or read from some of the first few, and offer any real sort of just accurate depiction of what reality is in your world?
Yeah, absolutely. So I think it's important to talk a little bit about what we've heard feedback, the feedback that we've heard from our community as we've gone out and actually had our communications team go out and talk to, patient cohorts, just members of the community that maybe weren't actively seeking care, members of our medical staff and their office staff. It was really interesting to see the, I guess the disconnect between perception in the community, perhaps maybe by what was even being kind of really focused on in the media, especially in other parts of the country, versus what we experienced here. And, we did have a period in, let's say mid-April, like I said before, where things I think were kind of at their peak, and we were having some tough weeks with PPE and that kind of stuff. But the innovations that we implemented in order to deal with that, I think were handled incredibly well, and really never put us in a situation where anyone's, safety was compromised in any way. And I think overall the community, perception about how healthcare handled things here in the Houston market and Fort Bend was really, really positive. I would like to say that, I think, some of the feedback that we got was just really astronomical. People thought that we had, 300 patients that were COVID positive in the hospital, which was, so far from the truth. I think at our peak, we maybe had around, right around 25. The number of people coming in seeking care thinking they had it was a different story. And I think that was just because of the newness of the disease, and people were experiencing symptoms and thought they had it. So at the end of the day, though, we had to kind of adapt to, what was happening, the symptoms were being presented, the volume of people that thought they had it, the doctors that were basically saying, well, let's direct you to the ER, because, if you have it, we really don't want you in the outpatient setting. And we had to basically just adapt to deal with that with a bifurcated process in the ED. We had an ED tent set up to keep patients cohorted in two separate paths, or, kind of vectors of care. On the inpatient side, again, cohorted units, telehealth to aid us in that. And then we implemented on the outpatient side, especially once the restrictions on elective care were lifted, we really had to find innovative ways to provide care as safe as possible, make that the number one priority, during the event and then going forward. And so I know that this may have been talked about already, but everybody is more than welcome to go look some details up on our Facebook page at Houston Methodist Sugar Land. But we've implemented outpatient processes that are very low touch, very like a pull system, very leaned out in order to get patients their elective, imaging procedures, elective surgeries, in a very, very safe environment. On the outpatient imaging side, we're actually doing a process through our Sweetwater garage that actually involves you checking in through the garage at these two kiosks. And they're basically two small little buildings on the first floor of the garage. You check in, you wait in your car. Within 2 minutes of you checking in, you're going to get a phone call. You're going to get registered over the phone, consented over the phone. Then you're going to get a separate phone call on average about 7 minutes later, where an imaging tech is going to let you know where to meet them so that you can go get screened, go straight back to the modality that you're going to get that day, get your test done, and you get escorted back out the door. And so you're literally spending no time in the hospital, in waiting rooms. We're ensuring social distancing by doing that. And so it's just really been amazing to seize, the opportunities to change the way that we deliver care in order to meet the expectations of our customers. And all the while also then deal again with the perception issues too, because I think people feel like heading back to the hospital for care, what we don't want is people delaying care, and we don't want people thinking that the hospital is not safe, because it absolutely is. And on top of that, to address, the issues of kind of the disconnected perception, we're doing everything we can just to make it as, low touch as possible. You see grocery stores, retailers all doing the same thing. And so we're doing things that I think are widely accepted because they're happening in all, in all industries across the market. and it's really what people want right now.
Thank you. So Sarah, I think you talked a little earlier about mental health needs, like in the immediate front and kind of what you're dealing with now and day to day. What's your best guess as what this is going to look like 6 months down the road, a year from now? Not in the form of what's going to progress with the pandemic, but from a mental health standpoint, how does the progression happen from sort of the phase that we're in now to ultimately kind of dealing with this thing on the back end?
Yeah, it's a great question, and one kind of that we can only speculate at, much like our counterparts in the physical health realm are doing, because the truth is we don't know how long things like this are going to be around. I'm very much inspired by kind of the just everyone is so, they feel like they have to kind of get the vaccine and all of that going before we kind of can see an end in sight. And that can be scary. And really it can cause anxiety. And I think that is really, for looking at someone who has no mental health problems kind of 6 months ago, we might see some people start experiencing some mild to moderate symptoms of anxiety surrounding their health. We might see some people have some pretty significant disruption in their job, in having a job, and then kind of the psychosocial impact that has on so many aspects of their life as we kind of deal with the economic implications that the pandemic has brought to us. So what we're looking at kind of for a long term is also how do we keep people healthy and well, and how do we get them to ask for help when they need help? So that's a big one that we kind of try to reach out to the community. We have an educator at Memorial Hermann who is constantly trying to raise community awareness to say basically that it's okay if you're not doing okay, and then educate people on how to access care. So we do expect to see an increase in people coming to our health systems for treatment. And really what we are trying to do at Memorial Hermann, and I'm sure our counterparts in the community are also trying to do for patients, is partner with our community agencies so that we can be sure that all of these people have access to the care that they're going to need. And really, I think we're in a new normal. That's kind of a catchphrase we have at Memorial Hermann of what does the new normal look like? And the new normal might be difficult for a lot of people. So I think it's just normalizing that we all may be experiencing some mild, moderate, or even sometimes severe symptoms of depression, of anxiety, of even kind of with our providers looking at what post-traumatic stress are they going to have after caring for some of these patients, or having a loved one and some complicated grief issues that might come up as a result for the patients that do succumb to this illness. So I think the vein that we want to kind of stay in is checking in on each other, of being good to one another, and if someone that you know and someone you love or yourself is struggling, to be comfortable and kind of get rid of that stigma that we were talking about a little earlier, and reach out for the help that you need, because it can be very meaningful and powerful once you do seek treatment.
Really good, thank you. So Connie, there is a question in the chat that I'll put to you, and then I have another question thereafter about all that the county is doing in the form of social determinants of health. So first, the question is, what do you recommend to people who are feeling socially isolated?
So we know that social connections are essential to well-being and often a protective factor, and that's really been a challenge. So we've talked about that, like using technology to stay connected. But we've also realized some of us have a little bit of Zoom fatigue, and it's that in itself can be challenging. I think reaching out to those individuals that provide a feeling of safety and kindness. We forget that. You know, where can we feel nurtured? Those relationships that really provide that nurturing. Maybe it's an aunt, maybe it's, you know, a faith leader, maybe it's your grandchildren, maybe it's just a friend. But that's something that we all need. Where do we find that nurturance? Where do we find that social connection? For individuals that are feeling socially isolated, I mean, we do have a lot of resources in this county. We have websites, we have phone numbers that, you know, we have a mental health resource line. I know a lot of you also have that. There is an opportunity to just call and talk to somebody if you need to talk to someone. So the county does have that. That's what I would encourage people to do. I mean, there's also national hotlines, but I think what we've done in Fort Bend County is also create those local numbers that folks can call. Talk to someone, tell them how you're feeling. Get outside. If you have a pet, you know, pets are great. If you don't have a pet, consider maybe adopting one or fostering one. I mean, we know that. We know the value of those things. But, and again, I'm not, those random acts of kindness, really reaching out to someone else has a benefit not only to the person that receives that, but to ourselves. Those go a long way.
Thank you. So beyond just testing, the county is doing a lot in connecting folks to resources, whether it be rent assistance, utility assistance, and then is now forming a big collaborative endeavor at the Gallery Furniture on 99, where folks are being connected to job resources and beyond other things. Can you give us a little recap of all that the county is doing on that front? And I know you're heavily involved with the Gallery Furniture endeavor, and kind of a little bit about what that is.
Yes, so we work very closely with our social services department, and we are really fortunate. I mean, you've all heard about the CARES Act, and so there's been a lot of money that's been, well, let me rephrase it. There's been funds that have been, we never know if it's a lot or enough. We hope that it makes a difference in people's lives. But there have been funds that have been set aside for rental assistance and mortgage assistance, and that's actually being coordinated through our social services department, through the county. So we have it on websites, social media, you know, so really, you know, encouraging people to get connected to that. We've also seen so many of our nonprofits and local food banks just stepping up to the plate in the school districts. I mean, it's been amazing because we know we need to feed people. We need to feed children, especially those children that haven't been in school and where they were getting free lunches. I mean, that's critical, and we need to plan for the summer. The initiative that Mike's talking about is a recent initiative with Gallery Furniture, where Gallery Furniture reached out to the county and to the county judge's office and to Commissioner DeMerchant, which is Precinct 4, like what can we, into the Texas workforce, into, you know, I believe the chamber and our HR department, but what can we do to feed people, to get them jobs, and to provide mental health resources. So this is an initiative that's at the Gallery Furniture in Richmond, Monday through Friday, 9 to 5. And I can forward the website, but also they're doing food drives, like every Tuesday, I believe, for the month of June and July. So they're partnering with the food bank. And it's amazing to see that, where, you know, again, a very significant business leader is saying we need to do something and we need to come together to address these needs. We need to get people food. We need to get them jobs. It's amazing how many volunteers are there and how many to help people, you know, maybe get new skills, update their resumes, and really get people connected back to work. But that important piece about mental health So we have some folks on site Mondays, Wednesdays, and Fridays. We have a partnership with Houston Galveston Institute to provide some remote counseling, and then also with AccessHealth. And you know, folks are coming. We want more people to be able to take advantage of this. This is not, you know, we're probably going to be sending them to you and connecting them to your services, but at least it gives them that, you know, we're there, we're talking to them, we're giving them some coping strategies, and then and following up also. Great initiative.
Thank you. I agree. Again, apologizing for some of the how crude these transitions are. Eliud, you know, we've talked through challenges and some of the misconceptions that were you know, being presented by folks. How much long-term strategic planning have you guys had a chance to look at? Is that even something that's factoring in now, or are you still at kind of just we're dealing with what's walking through the door day to day?
No, it's a great question. Actually, we just had a leadership retreat yesterday to take a lot of our strategic plan that we already had prior to COVID, what we were calling basically like our breakthrough objectives for the next 3 to 5 years, and then the annual goals that needed to be met in order to do that, and really kind of brought them into the current reality. And so a part of that was, you know, really a message or a goal of achieving, you know, hope. As I listen to some of the other speakers today, you know, talk about how to deal with this, I think whether it's the organization or whether it's the individual or a family, you know, unit, we have to plan for the future. You have to continue to look forward instead of being kind of paralyzed by the present. But looking forward also shouldn't, you know, involve, you know, false expectations, I think, for lack of a better term. So there was a quote that came out yesterday in our discussions from a pastoral counselor named Andrew Lester, and it was something along the lines, and I didn't write it down, so forgive me, but I think it's you know, that hope is a commitment to the future rooted in the realities of the present. And you know, I think that we, you know, as we think about kind of the normalizing, we have to accept that you know, the COVID-19 is around, and as organizations, it you know, our obligation at Houston Methodist Sugar Land is to create plans that are rooted in the reality of that being present, and then saying, but we're still going to achieve all these goals. You know, we see ourselves succeeding at the end of this year with dealing with any future cases of COVID-19 that come through the door without the business interruption that we experienced in March and April. You know, we see ourselves basically, you know, moving forward on a path where safety is the highest priority for our staff and for our patients and for our visitors. And so that strategic planning involved basically adaptation. That exercise involved adaptation of an implementation of the current reality into that future view, so that we can kind of start moving forward, and we're on a good path, you know, to do that. And that's really kind of establishing a certain sense of hope for ourselves as an organization. And we hope we help provide through those commitments and through those actions, you know, hope for the community as well, as they come here and realize, you know, that the processes we've implemented actually kept them safe, that they were actually really, really efficient, that they got, you know, their MRI and way faster than they used to before through this new process. We're getting a lot of real positive feedback from patients already about the new process that we've had and the ones that we implemented during the peak of the crisis. And, you know, we've even, you know, added, we've changed things to infrastructure, like you mentioned before, you know, the way that we changed the humidity levels in the hospital, because we know that the virus doesn't do well in more humid environments. We know that, you know, temperature can affect it, the air handling, air exchanges, all of these things, you know, we've taken into account and modified in the near term so that we can continue to accomplish the goals in the long term.
Good, thank you. You know, Mathew, I think one of the themes that has run through the other webinars was safety. I know we talked a little bit about that, but folks, I don't know, what's the data telling us in the forms of like your capacity over the last few months to normal, and and obviously there's a huge financial component to this, and trying to move through with what the data is telling you, and being there for patients. How does that look at Memorial Hermann Sugar Land?
Mike, I'm having a hard time catching the back end of that question. If I heard it correctly, I think you're asking about capacity.
Yeah, and just like whatever financial constraints that you guys are going through, if it's reduced, is it kind of moving forward, what the expectation is?
Yeah, well, I think Eliud, he hit the nail on the head. I mean, Methodist, Memorial Hermann, we're used to seeing infectious disease patients, and we're going to continue seeing infectious disease patients. Looking long term, our goals are not changed. As far as capacity, we are constrained. The governor has in place rules and regulations around certain capacity openings that you have to have in the event of a potential second surge. If there is a second surge, we are adhering to all of those. But as far as long-term goals, nothing's changed. Nothing's changed as far as that goes.
Okay, we're getting real close, so I'll do sort of the closing question, and we'll let everybody address it. Just a couple minutes, because we don't want to go over. But we are obviously significantly into a reopening phase, and whether that's something you agree with or not, it's not really an item for this conversation. But in your own specific areas, what does that mean for things moving forward? I know we've danced around this a bit, but I'd be interested, and I think the folks watching would be real interested in, and as we reopen, what are our expectations? What are challenges? And I'll start with you, Sarah.
Sure. In the mental health space, we look at reopening as symptom management. So understanding how opening impacts the human and human behavior, and looking at how we can support people, because we have, we don't know what lived experiences our patients come to us with. We don't really know, are they for completely reopening the state, or are they completely against it and kind of hiding in their houses, just waiting for things to be safe again. So really in that space, we're Switzerland, I guess. We just let them work through their feelings and provide just that support and positive regard that we can to help support them as they navigate that. Because I think that for all of us, because we all do have different experiences, is going to it's going to be different, and what we need is compassion and just acceptance that it's okay to feel the way in which you do, and to have someone to be open and talk through that without some of that preconceived notion or judgment that oftentimes we get when we're speaking to family or friends or even colleagues. So we're just trying to be there for people as they navigate that, because it's tough, and I don't know that there is a right answer.
So Connie, I'll ask the same to you.
So Sarah talked about patients, people. I guess, I see that with staff also. That is one of the biggest challenges. People have different experiences, different fears, different comfort zones, and it's challenging. I mean, the county was closed for 6 weeks, emergency closure. Then we opened up May 4th and gradually transition. That's definitely been a challenge. There's briefly, 2 areas that we work very closely with is the jail. So we provide services in the jail. We do sanity evaluations, see competencies to stand trial. So how, the comfort of going or sending, of my staff going into the jail, or my going into the jail, that presents a whole different challenge. The courts are reopening. Again, we've been having virtual courts and using Zoom. And so kind of how do we do this? How do we move to courts, to bringing people back into the courtroom? And just one quickly, another area that we work with is CPS. So children in CPS, we do like parent-child work and visit coaching. So we've had to have virtual visits. And again, you've all talked about this, what are the lessons? Like, what are the lessons that we've learned? In many ways, we have been forced to become better, to become more efficient, to remove some of those barriers to care, which, for example, in the CPS, having virtual visits allows some families to actually see their children that were not able to before, So that's the challenge. How do we not miss the lessons that we've learned and some of the tools that we've developed so that we can get to a new normal, hopefully that's better than our old normal.
So Matthew, if you'll kind of elaborate on that, and I think as we kind of look at the potential maybe for another wave of this, how much of a playbook is established now? And then obviously we've seen this first time, and if there were to be, a second wave or dealing with this in the future, how does that look?
Yeah, I can tell you we know so much more than we did when we started. I don't know if we have the perfect playbook, but I think we are absolutely much more prepared. We can control. We've taken measures. We've got screening protocols set up. We've got safe distancing protocols set up, sneeze guards. We do the low touch points that Eliud talked about earlier. We just focus on the things that we can control. The hospitals are much more prepared. Testing is much more readily available. PPE is out there. We hope there's not a second surge. That's certainly something that we would never, anticipate that we would ever hope. But if it does happen, we are more prepared.
Thank you. So we're close, Eliud. I'll give you the final question and just kind of have free reign to take that question and elaborate on it however you feel fit.
Yeah, no, I would echo, I think, everything that's been said by everybody. I think that, what we've learned and what we've established, I think, is just going to carry forward, at least through the end of the year. I think that is kind of the new normal, and it's the expectation of our patients and visitors to have, the screening stations and we're going to effectively test patients, prior to having procedures and things like that. There's a lot of that, I think, that is pretty common now across the board, across the industry, and I think those things will continue. So the good news is that we have a playbook that isn't necessarily being dialed down and then has to get dialed back up. I think it's just going to continue forward. And the challenges will really just to kind of stay ahead of any potential growth curve, as Matthew alluded to a second wave if it happens, all the while trying to also stay ahead of knowing what's in our customers' value stream and also our staff members' value stream. And what I mean by that is just kind of figuring out what it is that they want and then and providing that to them in the way that we deliver care. And I think Sarah mentioned that as well, is just that, we don't want to in any way say, well, this is the right way to do it, or if you want to wait something out, we don't get that because, you're maybe preventing or postponing, a screening that you really ought to get. Instead, we need to kind of address why the patient maybe feels like they should avoid, that screening, and then tell them what exactly we're doing to address their concerns and then get them to access care that they need. And so again, just really focusing on what the customer wants in order to keep them safe and make them and help them make the most informed decision possible.
Thank you. And thank y'all. There's a lot coming in through the chat with a lot of kudos and thank yous. So I think this was a lot of new information, but also a recap of what had been presented on the first three, and this is the last webinar in the series. So I appreciate y'all being so agreeable to kind of jump around from topic and subject matter. So thank you very, very much. The Chamber would like me to call attention to a couple new upcoming events. On June 10th at noon, there is a Zoom webinar, which is a conversation with Congressman Pete Olson. And then on June 11th at 8 a.m., there's another webinar, which is an infrastructure update with Commissioner Brady Prestige. If you are looking for more events, they are on the Chamber's calendar, which is on the website. And last, a big thank you to the sponsor for the sponsors, excuse me, for this series, all the attendees. But here again, calling out CHI St. Luke's, Sugarland Hospital, CU People Inc., the Fort Bend Medical Society, Memorial Hermann Sugarland, Houston Methodist Sugarland, and Safarth Shaw. With that being said, again, thank you, panelists. Thank you to all the panelists and all of the webinars. We appreciate you very, very much. To those that have watched, thank you so much. Here again, stay safe, stay calm. We'll get through this, and we'll see you next time.
Thank you so much. Appreciate it.
Yeah.